So, hi everybody. A very, very good morning to all my dear students and to everyone who's listening to us on YouTube as well as on the eMedicoz homepage. Right. Today is a very special session. We are going to talk in detail about your final 2 months strategy for your NEET PG exams. Yes, we all know yesterday we did have a notification which did confirm that the exam is going to be on 15th of June, right? So what I want to do in the beginning is I want to tell everyone that you should sit with a pen and paper, take down the things that I'm telling you as strategy, and then we will also be doing a follow up on my Telegram channel, on eMedicoz Telegram channel, right, with this strategy, right? So please remember, I want you all to sit with a pen and paper. Don't worry, we will have a planning, we will have a strategy, we will have everything that you need to combat your fear, right? So darna nahi hai, darna mana hai. Is everyone ready? Yes. Okay, so what I'm going to do is I'm going to divide your core strategy. Okay, so I'm going to divide your core strategy into 3 parts. Is that clear to everyone? Yes, so I'm going to divide it into 3 parts. There is going to be phase one. Yes, there is going to be a phase two of revision, and there is going to be a phase three. Yes, is everyone ready? So we have 3 phases. The first phase is going to be a phase of rapid revisions or rapid review. Is that clear? And I'm going to approximately divide your first phase. So we have approximately 60 days in total. So I am going to divide your first phase for next, let's say 15 to a maximum of 20 days. Then we have the second phase, okay, which is going to be a phase of intensive review, right? So the second phase is going to be of intensive review, for which we will keep 25 days. Right, so first phase is going to be 20 days maximum, which is going to be rapid review. The second phase is going to be intensive review, and we are going to keep it for approximately 25 days. And then we will have the third phase. Okay, so then we will have the third phase, which is going to be final review for last 15 days before the exam. So is the core strategy clear to everyone? So now I will divide and dissect what I want you to do in 3 different phases. Yes. So the first phase, which I said is going to be phase one of rapid review for next 20 days. What are the things that I want you to do in this time? So in the next 20 days maximum, so we will keep a target of 15 so that even if we stretch, we will reach 20 days for our phase one of revision. Okay. So this next 20 days is going to be a conceptual review revision through LRR. Yes. So our live rapid revision, right? Anybody who has pendencies, anyone who hasn't done that so far, yes, believe me, the live rapid revision that we have done, and if you have attended the videos once, you know that there are notes available for it. Okay, which were downloadable. Soon we will make the live rapid review notes available for purchase as well. For anyone who could not have access to that, we will make it available on eMedicoz MediMart section. Now, why live rapid revision for next 20 days? Because it covers concepts, it covers one-liners, it covers images, it covers the most important things that you should know for your upcoming exams, whether it is INICET or whether it is NEET PG. Okay, so usse kya hoga? We will also be able to cover our pendencies. And believe me, through the live rapid revision, it is absolutely possible to complete these subjects in one day each. In fact, what we can do is we can keep these short subjects for half day, and then those half of days that we have extra, we can use for other subjects, which are long subjects or vast subjects. Right. So next 20 days is going to be a rapid review of conceptual revision through live rapid revision. If you have seen the videos before, you may not see the videos again. You can simply stick to the notes, right, which were available in a downloadable format, as well as I said, if you did not have access, we will make it available on the eMedicoz app MediMart section very soon. Yes. Then comes the second phase. Now, in the second phase, it is going to be a phase of intensive revision. Now, how do we do intensive revision? So that we are reducing the volume, but we are not reducing the high yielding content. So, the second phase of intensive revision will be through DVT. Along with DVT, we are going to do the PYQ Ka Baap. So as you know, currently we are running the PYQ Ka Baap sessions for INICET. And once we finish the PYQ Ka Baap session for INICET, we will be bringing up the PYQ Ka Baap session for NEET PG as well as FMGE. So the second phase of intensive revision will be for approximately 25 days, okay, where we'll be focusing on revision through DVT and revision through PYQ Ka Baap, and we will give lots of tests, okay. Phase 2 will be for 25 days. Phase 1, target 15 days, but we can stretch it to 20. Phase 2, which is going to be intensive revision, is going to be for next 25 days. And our main goals in phase 2 of intensive revision will be not the notes now. It will be DVT plus lots of tests, okay, plus PYQ Ka Baap sessions. Now, when I say lots of tests, I want you to revise your fast track TNDs if you have access to that. You can revise your original NEET PG TND, right? Or you can utilize especially the tests we are doing on the test series section of eMedicoz app called as Transform 10x tests, right? So there are also multiple other tests in the test series. There are grand tests, and I will be talking about that separately in today's video. Then there are subject-wise tests, which are excellent for your second and third revisions. Then you have class tests, right, which you can again utilize to focus on especially the current pattern. So class test will focus on current pattern, whereas SWTs will focus on last 7 year of patterns. Exactly. So that's what I'm saying, Bache. If you don't have access to TND, use your test series. The test series has 5 levels of testing. Okay, so there are Transform 10x mini tests. Please do them. There are grand tests. There are class tests. There are SWTs, and there are mock tests. So there are 5 levels of testing in your test series, which is an absolute essential thing for your second phase of intensive revision. Now, I will elaborate again. So I said that 3 things that you need for your second phase, which will be 25 days, is DVT, because we will be doing some content, but we are focusing on the key things for all 19 subjects. We can spend 1 day each, but make it 0.5 days for your short subjects. And the days that you save from your short subjects, you can use them for your vast or bigger subjects. In the second phase, I also want you to do the PYQ Ka Baap for whatever exam is coming. Like INICET is coming, so cover up the PYQ Ka Baap for INICET. It ensures that you cover PYTs, right? So we are not just discussing the answers, but we are also going to do the PYTs for INICET. Okay? Third, I said do a lot of tests, and I said yes, the strategy remains the same. So I am doing the strategy based on both exams that are coming up. First INICET and then NEET PG. Okay. I will talk about the third phase as well. I've just talked about the first and the second phase as of now. Okay. So the first phase I said is phase 1 of rapid review, which is content based and through live rapid revision. The second phase, which is intensive review, which is through DVT plus test plus PYQ Ka Baap for next 25 days. Now, what is going to be the phase 3, final phase? I want you all to take it down in a pen and paper. Okay. The final phase, I want you to keep it for last 15 days, right? So final phase will be last 15 days. And what are the elements that you will include in the last 15 days? So number 1, we will definitely include another rapid review of DVT. DVT is going to be your last, go-to thing for your exams. As I said, there is a reason. It covers images, it covers one-liners, it covers PYQs, it covers PYTs, it covers algorithms that you need for clinical vignettes. It covers keywords. So we will include DVT also in the final revision, which is going to be one rapid cycle of DVT. Plus, We will increase the frequency of grand test in the last 15 days. Plus, we will start including the mock test for sure. I know some of you have already started the mock test. If not, we should start it in the second intensive phase and increase the frequency in the third phase. When I say mock test, I also include the CBTs. So I'm sure most of you are aware that on 19th April, we have the INICET CBT coming up. Please ensure that you give this CBT. It would be an eye opener. It will be matching the exam in terms of what you need to know. Please understand, unlike other platforms which create a lot of stress, and the pattern is not close to the exam, the damn CBT is created by the faculty, right? So every question is contributed by the faculty of the subject, and therefore they have a lot of insight on what is the highest probability of coming in the exam. We keep the difficulty level very, very similar, so it will give you the boost that you need, as well as let you know where you need to focus, what are your weak zones, right? So in the final phase, we will include, I repeat, in the last 15 days, we will include DBT, one rapid cycle. We will include grand test, more frequent, I will talk about it. We will include mock test and CBTs. We will surely include the wrong diary, right? So last 15 days, which is the final revision phase, these are the components or elements of it, okay? Now, coming to what should be the subject-wise prioritization. Yes, so this is the next thing that I'm going to talk about. Subject-wise prioritization. So most important subjects, whether you talk about NEET PG or INICET, these subjects do cover sometimes 60%, but it may go to 70% of the total paper, right? So, but 60% is for sure. So what are these most important subjects which do cover almost 60%? So you have to ensure that you know the most probable things, the PYTs, and your weak zones in these subjects. So these subjects are medicine, surgery, okay, obs and gynae, PSM, right? Even for any set, obs and gynae and surgery are very, very important. You get more MCQs from it as compared to medicine. The same holds true for NEET PG. So medicine, surgery, obs and gynae, and PSM, irrespective of whether it is INICET or whether it is, NEET PG. What is the difference? In INICET, these subjects will contribute 50 to 60%, and in NEET PG, these subjects will contribute 60 to 70%. So we have to be sure that these subjects, we know what are the probable topics, what are the PYTs, and what are my weak zones. And we are going to combine these three. The next important thing are which are the subjects which are covered a lot in one-liners, again in both exams, INICET and NEET PG. So the next priority are going to be these subjects: pharmacology, pathology, microbiology, and anatomy. So you will see a lot of one-liners even in INICET in these subjects. Which ones? So the second priority are pharma, path, micro, and anatomy. Okay, so these subjects constitute again a good number of one-liners. They could ask in the INICET even recent updates on new drugs, right? Or monoclonal antibodies and things like that in pharmacology. Similar things happen in path, micro, and anat. So anatomy, specific for INICET, we have a lot of dissection-based images. So we recently did a live session and we have an excellent feedback for dissection-based images that we specially did for upcoming INICET exam. So this is the second level of prioritization. What is the third level of prioritization? And open up your ear, because this is going to be an eye-opener and definitely something that I want to put across. A lot of you are ignoring the SARPO, the short subjects, right? So skin, anesthesia, radiology, psychiatry, and orthopedics. Now, why am I talking about the third prioritization as these short subjects? Because they are very scoring. So whether it is INICET or NEET PG, you have limited things coming in these short subjects, and they are contributing a good chunk of questions when they are put together. So they become your score bearers, right? So short subjects should not be ignored for both exams. I am telling you, they will build up your score. So let me repeat the prioritization. The first prioritization, so you should do them first, are medicine, surgery, obs and gynae, and PSM. My second prioritization is going to be special subjects where we cover one liners in exam. So that is pharma, path, micro, and anatomy. My third prioritization is SARP or SARPO or short subjects, where I believe they are very, very scoring, subjects. So they add to your final score and they give you the push that you need in a competitive exam, right? So skin, anesthesia, radio, psychiatry, dermatology, orthopedics. Now, especially for NECET, I have already highlighted a few things, and then the volatile part of the first and the second year subjects, like biochemistry. You can do it close to NECET in the last 1 week or last 10 days, because it's volatile, and especially they would ask the genetic part of it, they would ask the pediatric integrated part of it. So, inborn errors of metabolism. So you can keep the volatile part of biochemistry, especially for INICET, for your last 10 days. Okay. Now, the third segment that I'm going to talk about is going to be your daily goal. Yes. Are you all with me? Now we will write what we want to do every single day in these 2 months. Now, the daily goal, if I put it in a broader way, and then I will cut it one by one. One thing that I want you to do is this: one major subject every day, right? So major subject plus one minor subject every day. So we will be doing at least two subjects every day. We will not be doing one single subject, and we will not be doing four subjects as well. That's too much. The ideal is two subjects per day, one major and one minor. The third thing in the daily goal is going to be 50 MCQs. This is minimum. We can build it up to 100 MCQs every day, right? So the third segment of my daily goal is 50 to 100 MCQs every day, not more than that. If you do more than 100 MCQs every day, it's actually going to backfire, because we also want to see what mistakes we have done, and I will talk about it in a minute. The fourth component of my daily goal is going to be my wrong diary. Are you all with me? So the four components of the daily goal are one major subject, one minor subject, 50 to 100 MCQs every day, and wrong diary. Yes. Now, how are we going to do it every day? What should be the format of viewing these four targets? So, as I have talked about it before, that we will divide the day into four parts: a morning session, an afternoon session, an evening session, and a night session. Now, in the morning session, let's say we are starting at 8:30, 8 o'clock, or 9 o'clock. So from 9 to 1, or, let's see what your upper limit is. But in the morning session, I want you to cover the major subject, right? For example, I said the first phase of revision, which is the first 20 days, is conceptual rapid revision through LRR, live rapid revision notes. So you pick up the LRR of the major subject and cover it up in the morning session. What do I want you to do in the afternoon session? We will keep the afternoon session for a test or for MCQ practice. As I said, I want you to do at least 50 to 100 MCQs every day. It could be in the test format, which is always better, but we could also use the DQB. So you could make a custom test from your PYQ section or from the DQB itself. But it is better to do the test format right now. As I said, there are 5 levels of testing. So we could use the mini test, which is the transform 10x. We could use the daily quiz section. Currently, in the daily quiz section on the homepage on eMedicoz app, we are running a predictor series. And DAMS has been known that our predictor series actually gives you hit rate in the final exam. The predictor tests are available free for all on the eMedicoz homepage under the daily quiz. And then we do live discussion of this predictor test at 7 p.m. on DAMS Delhi YouTube channel. right? So everyone should give the predictor test. Currently, we are doing the INICET predictor test. And then after that, we will be starting the NEET PG predictor test. And we will also be doing the FMG predictor series. So, the predictor test itself is made by the faculty. So very, very high probability and high hit rate. Yes, we keep the difficulty level close to the exam. And like that, you can cover 20 high yielding MCQs. Another 20 high yielding MCQs in your afternoon session can come from the Transform 10x test. Now, Transform 10x has different series going on. So currently the clinical vignette series is going on. And if you scroll down, before that, there was the IBQ series. So tests based on only IBQs. And if you scroll down even further, you will see a series of tests which was specially done for INICET. For example, emergencies. For example, fractures. For example, milestones. For example, general surgery and trauma. For example, surgical classifications. So which means another 20 MCQs is going to come from the Transform 10x. Then you can make another 20 from the PYQ section. You can make a test on your own from the PYQ section of DQB or the DQB itself, or you could add a class test, a TND paper, or even for that matter, a mock test. So the afternoon session is going to be for testing. In the evening session, we will do the minor subject. So as I said, my daily goal has 4 components and my every day has 4 parts: morning session, afternoon session, evening, and the night session. So morning, major subject; afternoon is for testing; evening is for minor subject. What will we do in the night session? Everybody knows what I tell to be done in the night session, which should be for at least 1 hour. If you can stretch it to 2, that's excellent. The night session is for your wrong diary. It's very, very essential to please understand that you must go through the mistakes that you have done today. If you are simply doing MCQs but you're not seeing the mistakes, then you are not going to improve. Your score is going to plateau. So every day we should do a wrong diary. Okay. 2 hours at night, we are going to see very specifically only the mistakes that I've done. It has to be the specific subtopic, not the complete topic. So every day, give 2 hours to wrong diary. Even if you do this for next 60 days, I promise that your score will improve. Your number of correct questions will improve. Yes, are we all clear of the second phase? Now, in the second intensive phase, which I said is going to last for 25 days, where we are going to do DVT, we are going to do PYQ Ka Baap, we are going to give a lot of tests. What should be my GT strategy? Okay, so what should be my GT strategy? Exactly. So, currently, as I said, we are having PYQ Ka Baap. So that's the purpose at night, that we want you to stretch your limits. So if you're not able to do it by self, we will do it for you through the PYQ Ka Baap sessions that we do live on the app at night. Okay. Now, what should be the GT strategy for next 60 days? Now, for the first 30 days, I will say the minimum requirement is once in 10 days. Okay. Once in 10 days is the minimum requirement of GT. You can also mix GT and mock tests. So in the test series section, we have special mock tests for INICET, for NEET PG, for FMG. So in the next 30 days, so I'm dividing the 60 days into 30 and 30. Next 30 days, the minimum requirement of GT is once in 10 days. Maximum is once in 7 days, not more than that. Because if you do more than that, then you are not reviewing your mistakes. It's more important to review your mistakes than increase the frequency. So first 30 days, the frequency minimum is once in 10 days, maximum once in 7 days. For the next 30 days, we will increase the frequency to a minimum of once in 7 days, a maximum of once every 3 days. So minimum 7 days for the next 30 days and maximum frequency of once in 3 days, because reviewing is important. Okay. So please understand, don't focus on these places which are giving a lot of mock tests where students are scoring a lot, because that is a bias. Okay, it's a selection bias. Their questions, number one, are not contributed by faculty. They are made from the Q banks itself. So people who have done the Q bank tend to score higher. So it is a selection bias. They are not reflective of the real exam. Everyone knows that if you, whatever you're scoring as the number of correct in DAM's CBTs, will be the real reflector of what you will score in your final exams. It's been happening for past so many years. So take your CBTs seriously and focus on your number of correct, right? Please remember, reviewing the GT or your test is very important. So every mistake that you do, you have to see which category does it belong to. Okay, number one, is it a conceptual error? If yet, yes, you must listen to the video discussions. Okay, second, is it a recall error? Then you need to go back to your DVT copy, your LRR copy, or your main notes as well. If it is an application error, go back to your notes, learn the application. Okay, I'm sure the content is there. So either you could not apply because your content was superficial or inadequate, or there was a mismatch in understanding. If it is a mismatch in understanding, go to the video solutions. They tell you what are the keywords and how to apply. If it is a problem with content, superficial content or inadequate content, go back to your LRR, go back to your main notes only for those specific areas. Very essential is also to see your time management in grand test. We must be able to, ensure that time management is not my problem, because then my performance becomes poor. And that is why some frequency of grand test is important, right? We can't do less than that. So for first 30 days, GT frequency minimum is once in 10 days, maximum once in 7 days. For next 30 days, GT or mock test or CBT frequency minimum once in 7 days, maximum once in 3 days. Reviewing is more important than frequency. Okay, now coming to the final 15-day strategy. So you remember I began this video with core strategy of 3 segments. Phase 1, rapid review. Phase 2, intensive review. And phase 3 is final review. So now I am talking about the final review, or the last 15 days. What do I want you to do in last 15 days? I hope you're writing down, you have your pen and copy with you. So in the last 15 days, as I said, we will include a rapid cycle of DVT to ensure that we know all the keywords. The keywords have to come back to us as reflexes, and that's how the DVT is made. The DVT will also cover your PYQs. It will also cover your images. It will also cover your one-liners, and it will also cover your algorithm-based questions like next step, next best step, investigation, and so on. Treatment. Okay. So DVT, one rapid cycle in the last 15 days, plus a review of PYQ Ka Baap, especially if you have not done it before. Then in the last 15 days, we must go through it. And in the final 3 days, we are going to do the wrong diary plus DVT, right? Wrong diary, जो भी उसमें आपने one-liners लिखे हैं, जो भी अपने mistakes लिखे हैं, for the last 3 days, keep your wrong diary and a rapid flip over of DVT. Now, in the last 15 days, what should be the subject-wise subdivision? Because that is something that students always ask me, and they don't know how to do it. So you can use what I'm going to say now. So in the last 15 days, I want you to keep 1 day for obs and gynae. And if you have my LRR, or even if you have my book of, which is based on LRR, the OG last push, and I have some wonderful feedbacks as the first feedbacks, and I'm very grateful to all my students. So if you have my notes, you can actually revise obs and gynae in 6 to 7 hours. But yes, we can keep 1 day for it, where we will do obs and gynae, my notes, which could be the book OG last push, it could be LRR notes, it could be DVT, plus we will cover PYQ Ka Baap for respective subjects. So 1 day for obs and gynae. Similarly, 1 day for medicine. Now, when I say 1 day for medicine, especially for INICET, I want you to target ABG, right? So asset-based analysis. I want you to target ECG, and yes, in the Transform 10x mini test, you have a special ECG-based test. Okay, I want you to target emergencies before INICET. Okay, so 1 day for medicine, special focus on ABG, ECG, emergencies for INICET exam. Okay, next, 1 day for surgery. And especially for INICET, I want you to focus on trauma and general surgery. And again, there is a special test on general surgery in the Transform 10x mini test series based for INICET. If you scroll down, you will see it. So for INICET, specially target on trauma and, as I said, general surgery. Then I will say keep 1 day for PSM, and for INICET, especially focus on biostats. Okay, so 1 day for obs and gynae, 1 day for medicine, 1 day for surgery, 1 day for PSM. Half day, 0.5 day, half day we will keep for short subjects, which include skin, anesthesia, radio, derma, orthopedics, right? So half a day is good enough. You can easily do it through DVT, LRR, both. They will cover your PYQs and your PYTs. The remaining days you can keep for the remaining subjects. For example, you can easily cover up most of the remaining subjects in 1 day each. Okay, so whether it is ENT or ophthal, whether it is path or micro, but if you have a weak zone, you can adjust 0.5 days more for these subjects which we have gained from the sarpo subjects. So sarpo में half day लगाएंगे और जो half day बचेगा we can use it for the subjects that we are weak at. Yes, so this will be the strategy for the final 15 days. Okay, now please remember, as I said, this strategy incorporates all the aspects that you need for your exam. Number one, it includes content, which is going to be the first phase of revision, the rapid review phase through LRR in the first 20 days. Then this strategy includes rapid revision through images, algorithms, keywords, right? As well as one-liners, which is the next phase through DVT. 25 days. So second phase is intensive review, 25 days, DVT and intensive testing. Whenever you test, we make a round diary. We go back to it. Third, I talked about the final phase, which is 15 days, where I have talked about one more cycle of very quick DVT revision. I've given you the subject-wise division, and I've told you to focus in the final 3 days your wrong diary and flip through your DVT book. Yes, I have given you your daily division as well, where I want you to prioritize one major, one minor subject, plus an afternoon session for MCQs. I've told you at least 50 to 100 MCQs every day, and a night session with your wrong diary, right? I've also given you a prioritization of subjects. The first priority, as I said, was, yes, subjects which are always asked: medicine, surgery, obs and gynae, PSM. 60% of chunk from this. In INICET, it could be 50 to 60. In NEET PG, it is going to be 60 to 70. Second priority is subjects of one-liners, pharma, path, micro, anat. And I told you not to miss the SARPO or the short subjects. They are going to be your score bearers. So they will push up your score. Don't lose them. Okay. I said close to INICET, you could focus on volatile subjects like biochem or other first and second year volatile subjects, especially in your last 10 days before INICET. Yes, so this is what is the broad, strategy or core strategy for next 60 days. I hope you are going to use it, because I've spent a lot of time thinking on how the preparation should be, covering both the exams, INICET and NEET PG. Please use it. Let me know if you have your doubts, and we will keep giving our inputs, and we will keep following up with you on this strategy. Yes, I hope you find the session useful. You can write back to me if you have any queries. I will quickly take up the last few queries that I have, and then I will wind up the session for today. Okay, somebody is saying many of us didn't do the LRR. Okay, we did the main notes. Only then what to do? If you have a good memory of your main notes, like an image memory, and also if you can cut short the time, absolutely you can go with your main notes. You know, DAMS के main notes भी बहुत doable हैं, and you can do a rapid reading of that. So if you can reduce the time, if you can do it in next 20 days, yes, you can use those as well. Okay. Somebody is saying I wasn't able to attend online DVT and now it's pending. So yes, you should target it in the second intensive phase. So first 20 days or 15 days, you can keep up with your concept revision with LRR. In the next 25 days, I've kept for DVT. Please watch the videos. You would love it. They will hit you in the exam with the exact content that you need. If you feel you can't go through the videos, please go through the DVT book. At least do that. Okay, at least do that, because you know the book itself is so high yielding that if you have done your concepts once, it will help you in rapid review. Okay. Yes, we will continue with predictor series. As I said, it's free for everyone. Currently, we are doing the INICET predictor. We will follow it up with NEET PG predictor, and then we will follow up it with FMG predictors. Okay. Last, yes, exactly. I have kept 25 in the second phase revision and plus 15 days in the final revision. So last 40 days, I've actually kept for your DVT in various formats, but I have done a different combination. In the second phase, I have combined DVT with lots of tests. In the final phase, I have combined DVT with your wrong diary. Yes, so that's the combination that I want you to do. Okay. Yes, exactly. That's what I said. If your notes are taking time, please use LRR notes, live rapid revision notes. For anyone who could not attend it, don't have the notes, or didn't have the access, we are going to make the LRR notes available for purchase in the MediMart section of eMedicoz app, because we were having a lot of requests. So yes, they will be coming out soon, but it is going to be limited edition. So we will only be making limited copies based on the orders. So you can place your orders once the notes are available. Okay. Yes, don't worry. We will do the NEET PG PYQ Ka Baap, and we will also do NEET PG predictor series. We will do both. We have your back. We have it all planned. We are going to stick to the plan, and we are going to convert our plan into success, which will only happen if we work on the plan. Yes, so all of you, I have made the plan for you. I want you to work on the plan, because otherwise the plan will not work unless you work, right? So all the best. Take care, everyone. And lastly, I will take just 30 seconds to say thank you to all the birthday wishes that I'm getting in the chat box. My birthday is absolutely special because I started the day with all of you. I've started the day with something very productive, something that I could help my students with. So this is my return gift for everyone on my birthday, the core strategy for next 60 days. I hope you all like the return gift. Do give me your feedbacks and your blessings. Yes, you all are a part of my life, and I am very, very thankful that you exist in my life. So have a great day, everyone. Take care. Lots of love and lots of good wishes. I'm going to leave you with this strategy. Please work on it. Take care, everybody.